There's a statistic that an individual that experiences homelessness on average may die 12 years earlier than their counterpart who has a home.
Dr. Leandra Clark Harvey is a psychologist and the Chief Executive Officer of the California Council of Community Behavioral Health Agencies, an advocacy organization representing mental health and substance use disorder nonprofit agencies that collectively serve over 1 million Californians annually.
We know that 30% of the nation's homeless live in California. That's huge. We also know that 53% of those individuals have a behavioral health condition. That's quite impactful.
To say homelessness and mental health issues are complicated is an understatement. Shannon Wise has worked with the homeless on the streets of San Francisco for 20 years. She sees the priorities for the homeless differently than local government.
There's a level of transition to get somebody from the street to housing. So that's one of the disconnects in San Francisco. San Francisco assumes that if you put somebody in a shelter or, housing, that their problem is solved.
Shannon knows firsthand what homelessness looks like. She spent nearly a decade homeless on the streets of San Francisco. She was an addict and had behavioral and physical health issues that prevented her from getting off the streets, even when housing was made available.
The number one service they request is housing. And they don't want to go to a shelter, they want a hotel room, they want a one-bedroom apartment, and they totally are disconnected from the fact that they need mental health and behavioral health and substance abuse help.
She says the homeless and the organizations trying to help them don't seem to understand having a place to live doesn't make the homeless problem go away.
You can't treat just one aspect of what an individual is experiencing. You have to treat the whole person and understand that everything intersects. So your behavioral health condition, your mental health, your substance use disorder, and your environmental condition, malnutrition, lack of housing, lack of access to care, these all combined have an impact on someone's life expectancy rate. And for individuals who are homeless, they are at greater risk of all of these things colliding and really impacting how they live their life or don't.
Treating the whole person would mean a complete change in how the homelessness issue is addressed at the governmental, advocacy, and organizational level.
If I could wave a magic wand and make changes to the system, the integrated approach to providing care would be essential. The integrated approach to advocacy would be essential. And I do believe that that would trickle down to the way that we serve individuals, the way that individuals experience care. I think that would make an incredible difference.